In this animation, the bump of the cam lesion appears at the junction of the head and neck of the femur. We'll then look inside the joint, and you can appreciate how with flexion of the hip, the bump at first glides underneath the labrum and engages the articular surface or cartilage of the acetabulum. This results in what's described as a carpet delamination of the articular surface. Eventually the labrum will start to fail, but unfortunately damage to the articular cartilage, which has very few nerve endings, may be advanced before the more richly innervated labrum starts to tear, and only then may the first warning signs of symptoms develop that the hip has a problem.